Hello, everybody, and I'd like to welcome you to our Outbreak Management Advisory Board, to committee members and also those watching at home. You're all very welcome today. We've got quite a lot of agenda items, so I promise to do my best to keep us all to time today, as I know that we've got a number of important things to discuss. First thing with the welcome is just to note a few apologies that we've had to today's board meeting, and I'll ask Tracy to take us through those.
Here we have apologies from Phil Nettam from NHS Vale of York Clinical Commissioning Group, who's also the track and trace lead for Humber Coast and Vale. Apologies from Simon Padfield at Public Health England. Apologies from Mike Padgham from the Independent Care Group, with Bev Proctor substituting. Apologies from Steph Porter at the NHS Vale of York Clinical Commissioning Group, and apologies from Dr. Sally Tyra at the Local Medical Committee.
Thank you very much for those. So we'll note those apologies. And then agenda item 1 is declarations of interest. So if any board member has any declarations in relation to agenda items, so I'll just give a couple of seconds in case anybody is raising a virtual hand. If not, we'll say that we don't have any additional declarations to declare. Agenda item 2 is the minutes of the previous meeting, which was held on the 17th of March. There were no numbered actions recording in the last set of minutes, so I'm just asking you if we're happy to sign off the minutes from the last meeting. Waves or nods or hands up will suffice, and as long as I can see, yeah, thank you very much. The majority of people waving, nodding or smiling, I'll take that as acceptance of the minutes of the last meeting. Thank you for that. That then takes us straight on to agenda item 3, which is the current situation in York, and I'll hand over to Fiona to present this to us.
Thank you. I'm just going to briefly talk through what's in the agenda pack on page 9. So there hasn't been a great change since we last met. So you can see in the paper the numbers that we've listed there. And in fact, since this paper was published, our validated rate has dropped slightly further to 15.7 is where it stands at today. So we are still seeing that decline in cases across the city. Obviously, where the numbers get quite low, we can see it move up and down quite a bit from week to week. So that rate of 15.7 relates to around about anywhere between sort of 25 to just over 30 cases in York on a weekly basis now. So really seeing the numbers drop. It's good to say that that is the lowest rate within the Yorkshire and Humber region, and we have the 9th lowest rate across the country. Also of note is our rate in the 60 plus population, which we monitor carefully, and that's now down to 12.1 per 100,000. So also in the paper, we just talk about the impacts in terms of the deaths that we have seen. So unfortunately, since the start of the pandemic, we have seen 386 deaths in York residents. That is a lower rate than what has been seen nationally. We've got the epidemic curve there, you can see in the paper, so that just gives that real sort of graphic in terms of how we can see where we were at the start of the year and the peak that we went through and what that looks like now. Also, I won't talk very much about this because I know we've got a paper on it, but there's just a brief update at the bottom of that page in terms of the vaccination rollout across the city. So over half now of the adult population within York have received a first dose of the vaccine, and that continues to roll out well. The other bit just to mention here, is not in the paper, but I know people are always interested, just in terms of our hospital admissions with COVID in York. So as at the 31st of March, there were nine patients within York general and acute beds and 3 in ITU. So that has come right down from where we were at the start of the year. So I'm happy to answer any questions anyone has on the data. Otherwise, I'll leave it there.
Thank you very much for that, Fiona. So I'll just again give a couple of seconds in case anybody has any questions at this stage. If not, because of the future agenda items, I'm sure we'll pick up any issues later in the meeting. So thank you very much for that. And that then takes us on to agenda item 4, which is a presentation on supporting people to access the vaccination. And this is partly out of a request that we made at the last meeting to get a presentation and a bit more information on vaccination inequalities. And I'm pleased that Anita Dobson, nurse consultant in public health, and Professor Mike Holmes are both joining us for this agenda item. And I'm going to hand over to Anita first.
Thank you. So it's start the presentation, please. Fabulous, thank you. Just before I get into this, I just want to put it on public record, really, because this is another great example of how York as a community has come together to support people accessing vaccinations and you know, throughout this COVID pandemic. So it's recognition for everybody, really. Next slide, please. So just to tell you what's coming then, just a little bit of a background about the vaccines, just a data, but not data points, just to show you what data we'll look at when we're trying to look at prioritising around reducing barriers for people, what we're doing to address some of those inequalities and look at some of the barriers that we know that have come up, access to vaccinations. Next slide, please. So I'm sure people are aware that there's 2 main vaccines currently on offer. That just tells you a little bit about the difference in the vaccines. It's been well publicised. Each vaccine brings its own sort of like logistical obstacles that need to be overcome. But I wonder if it's okay for Mike to come in at this point, because I know that some people might have picked up in the news some media that's been put out today around the AstraZeneca vaccine. So I wonder if Mike can update us around that.
Yeah, thanks, Anita. So many people will be aware that there have been some concerns around the AstraZeneca vaccine for a number of weeks now, and that's been covered quite extensively in the media. The issue being around it being suggested that there is a slight increase in the risk of blood clots with the AstraZeneca vaccine, particularly something called a cerebral vein thrombosis, which is a blood clot in the brain. And this has been looked at by both the MHRA, the Medicines Regulatory Agency in the UK, and the European Medicines Agency. And the advice to date has been supporting continued use. There's been some new advice today, which I'll come on to in a second. The background incidence, so the number of cases we see of this cerebral vein thrombosis is about 3 to 4 cases per million people per year. And so far in the UK, we've used 20 million doses of AstraZeneca, and there have been 79 cases of thrombosis with 19 deaths. So the case rate is about 4 per million, and these absolute figures are really important. So 4 per million with a death rate of about 1 per million. And to put that into context, we heard from Fiona there, the death rate from COVID in York is about 1.5 per 1,000 cases. So that just gives us some context. So the absolute risk of thrombosis is low. The JCVI, so the Joint Committee on Vaccinations and Immunisations guidance today, is suggesting that we should continue to get AstraZeneca unless you are under the age of 30 with no underlying health conditions, in which case you should be offered a choice of alternative vaccines. So the reason for that is as we come down the ages, that incidence, that background rate is increasing slightly. So this will be for cohort 12. This is so 18 to 30-year-olds with no underlying health conditions. So cohort 12, they should be offered an alternative vaccine. So we're not quite at that stage yet, where we'll not be inviting cohort 10 until probably the back end of next week, the 15th of April. And therefore we'll not get to cohort 12 for some time after that, possibly well into May and possibly June. So the alternative vaccine that could be offered would be Pfizer, as you can see on the screen here, or the third vaccine that's been launched in the UK, the Moderna vaccine. So you'll have seen that the first dose of that's been given today. And the service at Askham Bar that I'm involved in, we're discussing with the NHS about offering Moderna from as early as next week. So we've been in discussions with them over the last week or so, and if everything goes well, then we should be able to offer it next week. There's quite a number of things that we have to put in place, as you might imagine: training for staff, the various processes around storage and administration, and of course the other thing to bear in mind is that Moderna does require a 15-minute observation period, very similar to the Pfizer vaccine. So we're hoping to start that next week. It can be stored at 2 to 8 degrees. It has an expiry life of 28 days at that temperature. That's really positive. And the 2 doses can be given, well, it's between 4 and 12 weeks apart. So it fits very nicely with the sort of timescales that we're using at the moment. So more information to come, but looking positive for next week. And certainly by the time we get to the under 30 cohort, we'll definitely be able to offer that as an alternative. Thanks, Anita.
Thank you. Next slide, please. Just picking up on that, the recommendations for the vaccine. So the second vaccine should take place around 4 to 12 weeks apart. But it was decided to reduce confusion for the second dose, that all second doses would be scheduled for the 12-week after first dose. And as you know, there were a lot of media around this, and this is to allow more people to benefit from that first dose. If for some reason that people go a little bit beyond that 12-week, it's still okay. It shouldn't put people off from booking in for the second vaccine. It's still the efficacy, the vaccine still works as well beyond that 12 weeks, so people should still book in. So because there are a few circumstances that people have gone beyond that. Next slide, please. As we know, the immunisation programme is to protect those that are at highest risk from serious illness, and that's why we've got the JCVI rankings, as it were, the priority order to protect life, protect the NHS, get as many people vaccinated as possible, and obviously included in that is the clinically extremely vulnerable. It's really important that people take up the vaccine, and especially these people in that group. Next slide, please. So a little bit that might not be as well publicised, and we want to do a lot of myth busting for people as well, to any anxieties that they might have. There's no evidence of interchangeability. That's a nice word, isn't it? Of vaccines. But if the first dose manufacturer is not known, so if people come and they say, I've had my first dose, I don't know what it is, I don't know what I've had, or it's not available, it is reasonable to offer an other vaccine in order to get that second dose. There's insufficient evidence to recommend routine use of COVID-19 vaccination in pregnancy. But what we would say to people is that's a discussion for that woman to have with a midwife, because they have to look at any risks around that, and everybody's an individual. So we would urge people to have that discussion with a midwife or the GP. The risks around breastfeeding and breastfeeding babies are not known, and there's an absence of safety data around that. So we don't recommend around breastfeeding along with the vaccine at this time. Similarly, children under 16, even if they're clinically extremely vulnerable, it's not recommended at this time. We do know that there's trials underway looking at a COVID vaccination for children, and we'll await the data that comes out from that. Anybody that's immunosuppressed and HIV positive should be given the vaccine. There's no reason why they can't take up the vaccine. However, if people have had been positive for COVID symptomatic, then the vaccine should be delayed. It's a 28-day period, and then come forward and have your vaccine. So next slide, please. Like I said, this is just a flavour of the data that we look at when we're looking at uptake and where we need to put as efforts around priorities. What are the barriers? Who's taking up the vaccine? Where have we got some inequalities? Next slide, please. And then this, we get the data broken down into ward data as well. Again, this is just an example of that as to where we might want to put our efforts. Next slide, please. Some of the things that we do know then, that we've been able to glean so far around some of the barriers, and I'll talk you through some of the possible solutions to this. A lot of what we're hearing is around practical barriers. One of them being transport, and I'm pleased to say that again, this is an example, like I said at the beginning, about York community coming together. We've had representatives from First Buses and Reliance Buses come forward and offer their services. What is it that they can help with transport? And we're exploring what that means in practice. Are we able to get people to a vaccination site? The other thing that came up, people were concerned about childcare, having to leave the children in order to go get the vaccine. That may ease, that barrier might ease as we move into the reducing the lockdown measures, but also it links into the next point around vaccination site and locations. Obviously, if we can work on getting more local vaccination sites, that is very helpful. So if you have to leave your child with someone, the amount of time is reduced. So we're working to look at how we get community pharmacies on board. But again, we've had offers from the York community, such as the Theatre Royal. Could that be used as a viable vaccination centre? And I think we have to understand there's a lot of work goes on in the background, in it, to backroom work to be able to stand a vaccination centre up. It's not just a case of rocking up and opening doors. There's a lot of work goes on. But the other big offer as well is from our 2 universities, that they could be used for vaccination sites when we move down into that age group cohort as well. So some really good work being scoped out to look at vaccination sites. The other barrier that we're hearing about is about home vaccination availability, and I know the CCG and primary care are looking at vaccinating people that are housebound. And then another biggie that we move on to is vaccine hesitancy. And one of the big things that we're hearing is that, hang on, as all good things, that's my phone going off, apologies, it's vets, my dog's got to go in for surgery tomorrow, so I hope that's still on schedule. That aside, oh, they're saying hello, I haven't cut them off. I'll just stop that. There we go, happy days. So where were I now? Vaccine hesitancy. One of the things that we've picked up on is that people that have been shielding for a long time, it's not that they don't want the vaccine, they're just frightened of coming out of their house, because for 12 months we've told them to stay in their house. So we're working on how do we build people's confidence up in coming out to be able to access. I mean, all along we've said, if you've got a medical appointment, you need to keep it. But some people are, they're frightened, and understandably. So we're working on building people's confidences up as well. And then one of the other things that we've heard is that, if they've missed, I've missed my chance because they've moved on to another cohort. It's never too late. That's the big message. For anybody that says, "Oh, I've too late. I've missed my chance." There are appointments available. I would encourage everybody. If you know somebody that's saying these things, it's never too late. Make your appointment. Come forward, and we're working on that as well. Next slide, please. And then looking at building on some practical work for this, then one of the big successes that we've had in York is around our local contact tracing. This was set up early doors before it were a national thing. We'd already set this up. Tick, fabulous work. And that's been really, really successful. We've got people that are trained to speak to people, understand what their anxieties are around COVID, and have COVID conversations. So what we're doing is we're looking at training our contact tracers to have vaccine conversations with people. So this week and next week, we're able to access Public Health England training specifically around vaccine hesitancy or people that's vaccine declined. That's vets again, they're not getting the message. And to have those conversations, to find out what people's anxieties are, to find out what their personal barriers are, and have a conversation to either myth bust or encourage them to come forward. Now, that training we've offered out not only to our contact tracing team, but we've offered it out to our local area teams, to our housing colleagues, and to our health trainers, simply because we want to work on, it's called making every contact count. So no matter what forum you're in, if vaccines come up in discussion, we've got well-informed people to have those discussions with people. So some of the work that needs to go on, like I said, backroom stuff to enable this to happen. We need a mechanism to be able to know what it is that our contact tracers are going to ring. And we've worked with primary care in able to access that data in a secure way, so we know who we're ringing. But and as importantly, the people who we're ringing know it's a trusted source that's ringing them as well. And we're looking at people who have actively declined the vaccine, but also working back through the cohorts again to have that individual conversation. Next slide, please. I think I've sort of like emphasised really that York have come together as a community, but there's some specific partnerships that me and my colleagues have been working with, and obviously you know, we've got Nimbus Care here, but we've worked with CCG and Nimbus Care. We're speaking to community leaders to understand people's specific issues. This is something that's very personal. And, you know, I've dealt with, you know, vaccinations and health protection for a lot of years. And in my experiences, having that personal conversation with somebody makes a massive difference to address their anxieties. But we're looking to find common solutions that can be put in place. And that's why we're working with partners. Next slide, please. Laid on top of that then is a systems approach. So if you look at it in a little governance almost, or are we working with partners, we've got a local group, public health. So myself, Philippa Press and Peter Roderick come together to look at inequalities from a City of York public health perspective. Then we link in with North Yorkshire Council to look at any wider learning or any wider shared work that we can do. But we also then link into Humber Coast and Vale, because everybody is interested and working together to look at inequalities and reducing barriers. So it's not just us beavering away. We've got contacts across the piece that we can bring the learning back to support our population in York. I think that's lasting, but I don't know. Let's just try it. Next slide. If no happens, I've finished. Done. Thank you. Any questions?
Thank you very much for that, Anita. Mike, I just wanted to give you a chance in case you wanted to say anything before I opened it up for questions.
To be honest, Keith, there's not an awful lot to add. I think Anita's covered quite a lot of that. But you know, on behalf of Nimbus Care, we're working with Anita and her colleagues to address and vaccinate anybody who hasn't yet come forward. But on top of that, we're also trying to reach out to specific groups of residents. So those with learning disabilities, for example, we've put on additional specific clinics for them. We've got a team being put together to vaccinate our homeless population, and they're starting to do that over the next week or so. Anita talked about pop-ups, and we're certainly working with community pharmacy. Sometimes pop-ups aren't the right answer, because what we knew with our flu campaign, when we put pop-ups in areas where take-up was low, it didn't yield great results. So we need to learn from that, and the contact tracing that Anita talked about, I think, is very important. And then the final thing I would say is just reiterate Anita's point about trying to work with partners to help people get to vaccination sites as easily as possible. So yes, the buses, we've worked with York Wheels and taxis, and we're making the Askham Bar site as accessible as we can. So I'll leave it there, but I'm very happy to answer any questions.
Thank you very much for that to both of you, and happy to open it for any questions or comments at this stage. Sian.
Yeah, I've had a specific question about, is there any psychological support available for people who are terrified of needles but want to do the right thing for their friends, family, the population at large? Because I think as I said to my partner, if somebody said the delivery method for the vaccine was they were going to get a spider to bite my arm, I wouldn't be having the vaccine, even though I would know it was the right thing to do. So I don't think we should underestimate fear of needles. Fear of injections is a very significant factor for some people. What can we do to help them?
You're absolutely right, Sharon. This is the individual approach. The training from Public Health England is really important, to have those discussions with people that might be needle phobic as well. And that's the importance of having that one-to-one discussion to find out exactly what it is that the anxieties are, and then working through that with that individual. You're absolutely right. Needle phobia is, it's a big thing for people, and I've we see it firsthand, the effects of that. But I think that's the way forward. We train people in having those conversations. There's also an escalation for our frontline staff that are having those conversations. If it's something that they find that they can't deal with, there's myself as a clinician, there's also Philippa Press public health specialists that they can then escalate that concern onto. So if it can't be dealt at one level, I'm certainly happy to have individual conversations passed on to us.
Thank you very much. Mark.
Yeah, just really to renew the commitment from our side in terms of connections and bus routes into the vaccine side. We've actually progressed this since the last management outbreak board. So we have information ready now with a clear network map that tells customers exactly where the vaccine center is and which buses, not just First, but all the other operators actually connect with it directly, and it will promote the connections within the city center to get there as well. Anything else, again, happy to. I think the contacts already exists with Philippa Press. Happy to support that and promote this. I think the other bit I just wanted to pick up is ask is this fear around what comes after the vaccine. So certainly we, having spoken to some members of staff, this kind of I will feel a little bit worse for wear the day after potentially, and is that potentially a deterrent for people? And certainly within our workplace, we have taken to kind of promoting that, yes, you may be, but it's a day and then you're fine. And maybe that needs to be the story as well, just to dispel a little bit what stories are being created by people around it.
Mike, I wonder whether you want to pick up that second point.
Yeah, thanks, Mark. I think that's well, before I talk about the medical side, can I just reiterate our thanks for the partnership working around transport links, and certainly the use of the park and ride sites. That's been phenomenal and critical to the success of the program. So I think all the cooperation there has been hugely appreciated. But coming back to the medical side, yeah, I think that's right, Mark. What we're hearing is that some people can feel a little bit unwell with this, headaches, flu-type symptoms, tiredness, maybe in some cases enough to take them to bed for a few hours, but it shouldn't last for any more than 24 or 48 hours. And I think that's a really critical message. And it's variable too, not everybody suffers it. Linking back to what we were saying about the AstraZeneca vaccine earlier on, I think the length of any symptoms is important here. So I think the advice is that if you have symptoms, particularly headaches, that last beyond 4 days post-vaccination, that's the time to seek further advice. And we'll certainly be putting information to that effect on the Nimbus Care website.
Thank you very much. Question for me, Anita. You talked about sharing work with North Yorkshire and at Humber Coast and Vale level, whether any trends or differences were beginning to be clear across the different geography. And I guess linked to that, I think it would be good to bring back a similar report in the future, once perhaps a little bit more is known.
Yeah, I mean, for now, what we know now is we're seeing exactly the same barriers, the same conversations are happening across the piece. We're not seeing anything standing out different for York nor across the piece, really. The barriers are looking to be the same.
Thank you very much for that. And I don't know whether other board members agree, but I think certainly a topic that we should schedule to come back once that data is there again, and whether that's at the next meeting or the one after. But if we could leave Tracy to arrange that with Anita and team, that would be fantastic. So thank you very much for the presentation and those questions. And that then takes us on to agenda item 5, which is on the York Vaccination Centre and good practice for people with learning disabilities. And we're joined to present this by Ruth Thompson. So hopefully Ruth will pop up onto our screens. Yes, and I'll hand straight over to you, Ruth. Welcome.
Hi, thank you very much. Thanks. Somebody's just going to share some slides for me as well. Oops. Sorry, that's the last one. Can we go back to the first one? That's it. So yes, I'm Ruth Thompson. I'm from York Inspirational Kids. We're a support group for families who have a child with a disability, and that can be a physical disability, a learning disability, or on the autistic spectrum. And we work with families who have children aged from birth to 25 years of age. Next slide, please. We've been contacted by a number of parents who were taking their young people along for vaccinations where they were struggling quite a bit having the vaccine. And that was for a number of reasons, mainly due to the fact that they would go and they would see queues, even though the queues it was very efficient and they were moving through quite quickly as a system. But a lot of our young people find it difficult to stand in queues, and there's a lot of cars waiting to get in and that kind of thing. And they're also going into sensory overload. So there's quite a lot of noise. There was lots of people there of all different ages, and some of our young people don't cope with very young children if they've gone along. Some of them don't cope with older people. So it made it quite challenging for them. And lighting and various other bits, as well as going into a facility that is brand new to them. They don't know what to expect. They don't know what's around the corner. And it was all building up anxiety for them. Next slide, please. So luckily for us, one of the lead nurses is a member of our group, as she has a young person with a learning difficulty. And one of the volunteers is also a member of our group. And we got together to see what can we do to try and make this a little bit smoother for our young people. And with the help of Nimbus Care, we were able to have a meeting on site and have a look and see what options we had. And what we agreed would be best would be to have a unit that was just for our people to use, our adults with learning disabilities and autistic spectrum, that they could go along and have their vaccination. What they agreed to do was, instead of it being 5 minutes apart, they made them 15 minutes apart, so nobody was being rushed. They could take the time, they could take in the surroundings. There was extra staff on as well, so if somebody was having difficulty having their vaccine, they could get somebody else in, and it wasn't causing any bottlenecks. They were absolutely brilliant with how they did that. They looked at doing everything in a calm manner. When people went in, they were able to go straight into a cubicle. There was no queuing and waiting. It was as if everybody was just waiting for them to arrive. The feedback from it was amazing. And it was really, really positive and had a really good effect. And as I say, we met on the Tuesday to sort of work out how we could do this, what would work best. The marquee wasn't being used as there were no Pfizer vaccinations happening the following week. So we were able to use the marquee, and staff were put into there for us, and it all happened the following week. So we had the meeting on the Tuesday, and the following Monday, Tuesday, Wednesday, it happened. And so anybody over 16 with a learning disability or autistic spectrum was invited to go along, and in a much calmer environment. And as I said, the feedback was absolutely amazing. And I can't thank Nimbus Care, and particularly Will McAvoy, enough. They went out of their way to work with us and ensure that our young people were well cared for. Next slide, please. We were then put in touch with York Wheels and Dial-A-Ride, because one of the areas that we don't have very good working partners at the moment has been with transport, because we tend to work with mainly children, but as I say, we work with children up to the age of 25. But Dial-A-Ride, they came straight on board and offered services for parents to get in touch, because there's a lot of anxiety about getting on a bus and then going for your vaccine and having to get back on the bus to go back. And so with their support, we've been able to put that in place for families as well, to be able to go forward. So, you know, as far as we've been concerned, it's been hugely successful. I'm hoping, fingers crossed, we can do something similar when we roll out for the under 16s, and we can be able to offer something similar again. But, you know, on behalf of all of our families, it's a huge thank you and a job really well done. So thank you very much.
Thank you very much for that presentation, Ruth, and joining us today. It's certainly really interesting for me, and I'm sure others, to hear about that and the changes that the service made. Thought I'd bring you in, Mike, if you're around, whether you wanted to say anything. And obviously there was a lot of thanks for your team there.
Yeah, well, thank you, Ruth, for that. And I think, you know, these things work in two directions, though, don't they? And I think, you know, we obviously want to help and support, but talking to you and your teams, I think it gave us the ability to understand what was required and put these things in place. And obviously we'll be doing exactly the same when the second doses are required. So yeah, I think again, I'd just bring us back to the power of partnership working and sharing expertise and listening to other agencies and trying to do what we can to make things as good as they can be for our residents. So yeah, just a thank you, Ruth, really.
Yeah, thank you.
Sian.
I just wanted to say, I know I go to so many meetings where I bang on and on about why we should co-produce solutions to the problems that we have. But this is why. I think that was so lovely to hear, Ruth. It was so fantastic. It was also so good to hear that your relationship with Mike and with Nimbus Care was about, let's figure out how to do this. Really simple offers of come and meet, come and get on site, come and see what's happening, come and see what's possible. And together you've figured it out, you've done it, and everybody had a much better experience. So I am absolutely delighted. And whenever anyone asks us for an example of co-production in York, we've got another one. Thank you. Thank you so much.
Thank you for that. And I think, Ruth, I don't know whether the slides that you showed us were included in the agenda pack. But if not, we will make sure that they are after the meeting. So as Sian said, that can be shared and looked at as an example of work. But appreciate you coming and sharing that with us.
No problem. Thank you for asking us along.
Thank you, Ruth. So the next item is agenda item 6, which is an update on the York Test and Trace system. And I'm going to hand back to Fiona for this.
Thank you. So this is the paper at page 11 in your reports pack. So I'm just going to pull out a few of the highlights from that. So you'll remember at previous meetings we've come and presented our plans in terms of lateral flow testing and how we're adapting and changing that. So we have gone live today with our latest model of lateral flow tests, which is basically that we've taken away eligibility criteria that previously existed. As such, those tests are now available for anyone within York who wants to access regular testing. And the only group that we don't recommend having regular testing is children below secondary school age. The other bit that's changed within that offer as of today is that we also move over to a kind of a mixed model. So if people want to come to one of our testing sites and have the test administered and the processing done for them at the test site. We'll continue to offer that for residents, but we also move over to what we call a collect model, so that if people want to come and pick up tests and do home testing, that is available for them. And how we've set that up as well is that our staff at our testing sites, if people want to do home testing but are a little bit unsure about how to do it, and have got questions to ask, the staff at those sites will happily do a demonstration, talk people through the process so that they can do that sort of high quality testing at home. So we continue with the 3 sites that we currently have at the 2 universities, and also at the leisure complex up at the community stadium, and then we open a 4th site at Foxwood Community Centre, which opens next Monday. We are also opening, we've been working in partnership with the MacArthur Glen Outlet Centre, so purely for the staff who work within that centre, we are have opened another site for those staff. There's about 1,500 staff who work at that site, so it's part of our commitment to kind of ensuring safe reopening of retail from next week. So the basic message really around testing is that people have got a number of ways of accessing lateral flow testing now. So workplace, if your workplace is doing a workplace testing program, that's kind of your first port of call. Secondary schools are offering it to pupils, so pupils can access it there. But then there is an offer of any of our sites across York that people can access those. For people who can't get out, don't have the transport, can't access one of our testing sites and aren't part of a workplace testing program, on the government portal there is also means to order lateral flow home testing kits as well, so that is another option. So really we're seeing testing, it's obviously testing doesn't stop you from getting COVID, but it's one of the tools that we have in terms of identifying infection and breaking those chains of transmission. So it's something that we want people to access and take up as we try to get back to some kind of sense of some kind of normality as more opens across the city. And I've also put in there that we are exploring a city centre testing facility as we expect more visitors into the city as well. So I've just got a few graphs there in terms of what the uptake of lateral flow testing has been since I've just put in data since the start of February. We're running this testing since before Christmas. So you can see in terms of residents who come and have lateral flow tests at the 3 sites, we had initial good uptake. It dropped off a little bit. We had another kind of surge at the start of March where I think that was mainly linked to secondary schools going back and primary schools going back and people wanting to access testing then. It's dropped off again more recently, but I suspect as more opens that we'll get more interest again in people wanting to take that up. The second graph there is just in terms of the student testing. So you can see obviously throughout February, the grey bars represents secondary school and primary school testing of staff. And then that big increase there at the start of March was where secondary school pupils became eligible for testing, and we did a huge amount of testing to enable that safe return of secondary school pupils. Also in there, staff and students at both of the universities throughout this whole period have also committed to undertaking regular testing and continue to do so at the 2 sites. Businesses have been able to register to offer testing for their workforce, and we know that a number of businesses in York have taken that up. So also in the most recent week up until the 1st of April, we know that just over 3,000 tests have been carried out on York residents through a number of workplace programs as well. Then just moving on to contact tracing. So yes, we started delivering contact tracing on a York-based model back in October. Initially, that was done working in partnership with the National Contact Tracing Service. So we followed up people 24 hours after the national team had tried and failed to contact people. On the 10th of March, we moved to doing contact tracing of all cases in York at 0 hours. So basically, as soon as somebody's diagnosed as being positive and are entered onto the national database, our local service then initiates the contact tracing at that point. So you can see in terms of the numbers of people our local service is dealing with over a weekly basis. So you can see obviously as our number of cases in York has kind of peaked and troughed, obviously the number of cases that they're contact tracing has gone up and down. And then also you've got in terms of how many people we successfully contact. So on the bar chart in the papers, you can see when we were following up after 24 hours, our local service, our success rate was about, you know, anywhere between sort of 60 and 80%. So these were essentially the people that the national team had been unable to contact, and then we would try via telephone and also via home visits. And overall, what that meant in combination with the national team and then our team, approximately 90% of all positive COVID cases were successfully followed up and contact tracing was done with those people. So when we moved to doing all of the follow-up of cases from the 10th of March, what you can see is that our overall success rate has stayed the same, if not slightly better. So in the most recent week, 95% of all cases were successfully contacted, and contact tracing was initiated with those. So you can see in the box there, that's just a kind of a run through of what the process is for an individual once they've tested positive and how they're contacted by our service. And then just to sort of some of the benefits, particularly that we've seen since we've been doing all of the contact tracing. So there is something about a contact via a local 01904 number that people recognise, and also it's a number that people can call back into. The national service is a bit anonymous in some ways. You can't go back to them and sort of query what was said or ask any follow-up questions. So that's something that people appreciate. And one of the other benefits as well with us doing all of the contact tracing of cases is it's much easier for us to identify where we've got a household where you may have sort of 3 or 4 positive cases within the household. So rather than that household getting several different calls by different people in the national team, we can easily recognise that this is one household, and we can just make one call and speak to one person in the household and do all of that contact tracing in one go. We've also been able to signpost into local services, so some of the more recent examples, as well as the kind of support around self-isolation payments, also, you know, where it's been appropriate and people have needed it, things like bereavement support, we've been able to signpost people to. We've also been able to, you know, gather much more sort of the soft intelligence and recognise where we're kind of starting to see patterns of infection, and are able to give support to those locations where necessary. And also to kind of build up that relationship between our contact tracing team and some of our local venues, so that we can, you know, give them some support where they're having more than one case. Also, as I say, we do home visits. Obviously, the national team can't come out and do a home visit to York. So if we can't contact people, we can call round and hopefully speak to people and do the contact tracing or leave some written information for them. And as I say, you know, a lot of the feedback that we have had from residents is that, you know, they're appreciative that this is a local service calling, and there's an element of trust there. So having moved over to do all of the contact tracing in York has certainly been very positive for us, and we've got good feedback. So happy to answer any questions on any of that.
Thank you very much for the report and the update, Fiona. So open it for any questions or comments. Otherwise, we're noting the report that's in front of us and the update given. So thank you for that. And then that takes us on to agenda item 7, which is an update on the LGA peer review of our outbreak management plan. And Sharon is going to present this.
Yes, thank you. I'd like to start off really by saying thank you to everyone on this call, but also your teams who gave up their time to be part of the peer challenge. I hope you've all had an opportunity to read the report. If you haven't managed to read the whole report yet, then I would encourage you to do so. It's a delight to read because it really highlights all of the positive work that has been going on in York, some of which we've already talked about this evening. But just to, for the benefit of people who may be watching the call, I thought it'd be helpful to just take you through some of the highlights. So first of all, to say something about the LGA peer challenge approach. Peer challenges are delivered by experienced elected member representatives and officers. So in our case, we had representation from Barnsley Council. The chief executive from Barnsley Council led the review. Our elected member lead was Councillor Ruth Dombey from the London Borough of Sutton. We had Julia Weldon, who's the DPH in Hull, but chair of the Yorkshire and Humber Association of Directors of Public Health Network, colleagues from Public Health England, a colleague from the Joint Biosecurity Centre, as well as colleagues from the LGA. So we had quite a wide-ranging team with lots of experience who came to virtually meet with us in York. And so the scope of this peer challenge was really to look at all of the elements of our outbreak management plan and our approach across the city. And they then did deep dives into the work that we've been doing with schools, colleges and universities, and the work that we've been doing around care homes. So they did a little bit more of an intensive deep dive into those areas. I think it's a testament to our partnership working in York that over the 2 half days that they were with us, they spoke to more than 40 people. So that is, you know, incredible that we had so many people across all of our agencies in York that gave up their time to be part of the process. They participated in 16 meetings. Some of those were one-to-one meetings, some were focus groups. And also they we sent them lots of information about York. So lots of written material, evidence of the work that they were doing as pre-reading. So their estimate was that the peer challenge team spent 145 hours in total evaluating our response, which would be the equivalent of one person spending more than 4 weeks based in the council. So quite an intensive process, even though they were only with us for quite a short period of time. What I think then, there are lots of positives in the report. I think first of all, they reflected on our can-do approach in York, which we've already heard an example of from Ruth's presentation earlier. We're very good in York identifying an issue and then coming together to look at practical solutions. And they saw lots of evidence of that while they were here. So they certainly commended our approach around that. They also commended the approach that we've taken as a public health team. So I made a decision very early on in the pandemic that it was important that public health worked with and alongside not just council services but other partners, and so we decided to take that embedded approach, which was also, I think, reflected as an example of good practice. That isn't a model of public health that all local authorities have adopted. So there was recognition of how successful that's been in York. They particularly reflected on our communications and engagement work. Were very complimentary of Claire and her team, but also communication leads in other partners, agencies who have worked together, together with our local media, both print media and social media, radio, etc., that have worked with us in terms of promoting our key messages, and residents who have participated in our live question and answer sessions. There was a recognition as well, I think, of the builds on the can-do approach, but very much our optimistic view as we are planning our route out of lockdown, how positive we are and how confident we are as a city that if we work together, we can weather whatever the pandemic throws at us. And I think we've been able to evidence that up to now. And so they were impressed with our level of confidence and optimism in the recovery of the city as we go forward. There was recognition of our concern that we've discussed here about, York is a magnet for visitors, and perhaps the unique challenges that brings to us as a small medieval city with narrow streets, coping with large numbers of visitors, and the unique challenges that brings to it for us in opening the city safely. But they also acknowledged the planning that we're already putting in place for that. And so in summary, they've said that there's much to be proud of in terms of our response to the pandemic. And they identified lots of good practice that they were then going to take to share with other areas, because all local authorities will go through a peer challenge process at some stage. So going on to the recommendations then, obviously every peer challenge will come up with some recommendations. So they talked a little bit about resilience and capacity. So I think we've acknowledged on a number of different calls that many of us are on, that we're tired. If we think about particularly our health and social care, that have worked so hard through the pandemic, people are tired, and so there was a reflection of the need for the council, but I would argue as well other organisations to think about how they support resilience of staff as we start to come out of lockdown restrictions, and we start planning for the summer, but also in health and social care, we're already planning for next winter and what COVID and flu may bring us next winter, about thinking about that resilience. This is something we're already doing within the council. We have a cross-council group that's led by HR that is doing a lot of work around this at the moment, and I'm sure that other organisations are doing something similar. We've also had a mental health summit. We know that mental and emotional well-being are issues that all of our staff have raised. So many of you on the call will have been part of that mental health summit that took place a few weeks ago. An outcome of that summit will be that citywide approach for how we can support our residents, but also all of us and the organisations we represent, the measures that we can put in place to support our mental health and well-being. So that work is already underway. The other recommendation was around how we can build on the public health model of working that we developed through the pandemic, and how we sought to build on and further develop that. And also talking about capacity within the public health team. So there's already been some steps on that. So following the corporate review within the council, public health has now been established as a team within the centre core of the organisation, reporting directly to Ian Floyd as Chief Executive. We're already having discussions about how we can further integrate public health across the council, and obviously continue the partnership that we've been doing so successfully over the last year. And there's also been an agreement to create some additional capacity with a new leadership post within our health protection function. So already some progress on that. Talking about engagement in communities and partnerships then, there's so much already going on around the city for this, but we can highlight the work of the Human Rights and Equalities Board around inequalities. We can talk about the new Health and Care Alliance and the new vision for better integration across our health and care services. And those are just some of the partnerships we've got across the city. So I think we would argue that we're already doing a lot of that already. And then finally, they talked about the need for us as a city to plan for worst case scenarios as well as best case scenarios. And so based on discussions in other meetings that have taken place just today, actually, we're going to set up a task group to look at all of the different modelling tools that are available to model the impacts of COVID at the moment. so that we can work to develop a single vision really for York about what the best case scenario, worst case scenario might look like, and ensuring that we have plans that are fit for purpose, particularly as it's very likely that we will see a further wave of COVID as we go into the autumn, and there will be a need to deliver another COVID vaccination process, as well as seasonal flu vaccination in the autumn as well. So our partnership working doesn't stop. It will continue. But I think the report, just to finish, Keith, is very positive. There's so much for us to be proud of in here, as well as, you know, highlighting those areas that we want to further build on and develop as we restrictions are lifted and we head back to a hopefully sort of normal post-COVID world. So I'll stop there, but very happy to take any comments or questions.
Thank you, Sharon. So as you say, open it to comments and questions, and to extend your thanks to all of the partners for the ongoing work that sort of shines through once everybody's had an opportunity to read the peer review. Sharon, I know you've sort of given us quite a comprehensive update there on the recommendations and the work underway. But presumably that can come back sort of set against a little action plan against their recommendations to a future board meeting.
Yeah, very happy to do that.
Great, thank you very much. I can't see any further questions or comments, so apart from, I'm sure, echoing your thanks and the ongoing work in that area. So that then takes us through to agenda item 8, which is the refresh of the outbreak control plan. And before the introduction, Sharon, just to check my own understanding. So the draft of the refreshed plan was attached, in a sense, is being consulted on, and then we'll come back for a final sign off at a future outbreak management board. So all that we're doing today is highlighting that process and then asking partners to get back in touch with you before we then sign it off at a future board meeting.
Yes, that's right. So I just was going to kind of introduce it and put the context around the refresh of the plan.
We've had two lengthy verbal presentations, so that was my hint to get to the outcome that you're wanting.
I will. So it's essentially we were required by Department of Health and Social Care, as were all local authorities, to update their outbreak management plans. So what you've got here, the core elements of this plan are the same as the plan that we've been working to for the last year. There are some additional elements. So it's possible that when you read through the plan, it's quite lengthy, and you want to focus on the new sections. So the new sections, we had to demonstrate our plans to address any new variants of concern, action on enduring transmission. So by that, they mean whether we have any pockets across the city or any workplaces where we can see there are repeated cases of infection. Enhanced contact tracing, which is what Fiona was talking about earlier. Our ongoing work around communications and infection prevention control measures, hands, face, space, and how we've adapted those communications messages throughout the pandemic. To support the rollout of the COVID vaccination programme and to monitor where there are inequalities in the uptake of the vaccine, as we've already talked about here. And then thinking about living with COVID. So the hope is that we don't have any further lockdowns. So people are going to have to learn to live with COVID. And so our plans for how we were going to address that. And so those are the additions. So as Keith has said, I'm introducing it here. I'm asking you please to look at it. If you've got any comments, or in particular, if you would like any amendments, if you could please send those through to me, if possible, by next Friday, the 16th of April, if possible. The final version will then come to our next meeting of this board in May. And then once we've signed it off, it will go to the council executive to be adopted as a council plan. So that's the plan, Keith.
Thank you very much for that, Sharon. So I'll just give a couple of seconds in case anybody wanted to raise any comments or amendments at this stage. If not, we'll note that request to get any comments to you as soon as possible, so that can then be reflected in that next version that comes back to us all. So thank you for that. That then takes us on to agenda item 9, which is the communications update, and I'll hand over to Claire.
Thank you very much. I've got a presentation as always, so if we can, I'll whiz through it because I'll take, I appreciate that time is stretched, so I'll just try and pull out the salient points. If we can go to the next slide, please. So since we last met, a new government message has come out, which you'll know as fresh air. So this is just to remind you that as well as hands, face and space, we are adding fresh air to our key messages, which again will be consistent and reinforce those as many places as we possibly can. Next slide, please. As Sharon just mentioned, we've updated our outbreak management communications plan to reflect the draft updated outbreak management plan itself, and introduced an additional phase, which is the safely recover phase, which is to help move us through the various different stages of reopening. If we can go to the next stage, next slide, please. Thanks. So in pink, you can see the additions, which really are to pull out the fact that we are now very much focused on behavioural change and adapting to, if you like, our new ways and living with COVID. The safely recover phase is actually using the same communication strategic approaches as both the regular updates for phase 1 and the alert following a spike or changes in restrictions in phase 2, but with just the behavioural element added in. If you could go to the next slide, please. Our roadmap, we've completed a roadmap now right until June the 21st, as you can see. So we're planning to really focus on reopening the city and prompting safe behaviours throughout the city, whether in shopping centres or in different premises, supporting the emotional health campaign and definitely the work of the Mental Health Summit, and then continuing to promote the testing and the vaccination programme, working very closely with the NHS and CCG for that. Next slide, please. Just to remind you what the roadmap steps are, we went through this past month, step 1A and step 1B, which is on the 8th of March, supported more children returning to schools and back into school premises. And then on the 29th of March, opening up the leisure and outdoor areas. If we can move on, please. And then so just to move on again. So this month we did release lots and lots of press releases to support COVID, 27, which is more than we usually do. But that's really simply because we supported the 2 different steps, the 8th of March and the 29th of March. And then, of course, you'll remember that the 23rd of March was recognising a year on since since lockdown 1. So we supported that as well. Move on to the next slide, please. We also introduced this month a new update of data, which is where twice a week now we share the vaccination data, which is basically showing what many people across York have been vaccinated and what percentage of the population that is. And that's really because as we move through the new reopening stages, we want to sort of build confidence and hope really that we are getting to a place where the majority of people in York have been vaccinated. If we can move on, please. It also sets a norm, just to sort of reinforce that. So it sets a norm that being vaccinated in New York is a good thing and a normal thing to do. So here we are. This just reminds you of the different communications that would take place over the next steps ahead of us. So step 2 is our next step on the 12th of April, and we're preparing for that now. We'll start preparing for the 17th of May, the third step, as we get closer to it. As of yet, we don't yet know what the 21st of June is likely to be, but of course, there's lots of news about what that might mean, everything from vaccination passports to goodness knows what. And as you know, there's a number of test events taking place over the next month or two to let us understand what that might mean and what we can do to support people stay safe as we learn to live with COVID. Can we move on to the next one? This just shows you the work that we did for the 23rd of March, so very much supporting partners, including St Leonard's Hospice and the Minster, etc., and Nimbus Care to sort of share and support the city, as well as taking the opportunity to thank residents, partners, and everyone who's worked so hard over this past year to keep everyone safe. Moving on, please. Next one. Just examples of some of the communications that went on to support Easter and what steps we need to take to keep everyone safe. Next one. More examples. So this is to prepare for the 29th of March when things began to open. And you'll see that some of our visual prompts, the let's keep York open, hands, face, space, are different. And I'll just touch on why they are different to the ones we used before as we get through the presentation. Moving on. This shouldn't say the 12th of March, this should say the 12th of April, so apologies for that. Somehow I've gone back a month. This is the work that we did just this week on Monday when the Prime Minister announced that the 12th of April was going ahead. We made sure that we were ready for it and we've shared some information about how we will support the city reopen. Next step, please. Testing, so we supported the launch of the Foxwood testing site and reminded people where they could go to get tested throughout the course of the month. Move on. Thank you. One of the things that is becoming apparent is that people's physical health may be not as good as it used to be, particularly older people, and we've been promoting and prompting people to get moving to try and start building up that physical health, whilst at the same time working with partners to share what we call Feel Real York, so emotional health messages to make it normal to seek out and get support when it's needed. Next slide, please. Next one. So this just reminds you of what we're doing to help the city safely recover. It's a 4-stepped programme which we're working with the Public Health England Behavioural Science Unit on. And last time we met, of course, Dr. Dale Weston talked about this campaign and this trial, I should say, and other work that they've done. So moving on. We asked them to review our existing signage in the city, and of course hindsight is a wonderful thing, and they provided some recommendations based on not necessarily what works in York, but on broader what's worked elsewhere. And as we go through the next month, we'll be finding out what works particular for York and give us an opportunity to refresh the signage and anything else that we need to do in the city to make it safe for York. The recommendations we've got in front of you are just based on insight from other areas, but very useful and helpful stuff that provided us with the first refresh. And if we move on to the next slide, you'll be able to see the difference. So excited as we were for the first round of signage that we put up last year, you can see how different it is and how much we're actually just being very simple, very clear. We've got a reason why, let's keep York open, and we've got 3 behaviours, hands, face, space. And we either provide them collectively, so on bollards or on bus signposts, for example, or posters for business premises, or we provide them as an individual safety prompt through either flags that we'll have displayed in the city centre areas where people congregate, or on A1 boards through different areas where there's high footfall. And if we could just go to the next slide. This just tells you the work that's going on ahead over the course of the next sort of couple of, 6 weeks really. So on the 25th of March, we had our first Zoom webinar led by Behaviour and Insight colleagues at Public Health England, 66 registered attendees from across different business premises that had either outdoor space or were interested in what they could do to keep their own premises safe. The next event that we've got, if you like, is on the 19th to 20th of April. Public Health England Behavioural Science team will run 4 focus groups with businesses with outside space to talk about what has worked and what hasn't. That will help us refresh our next phase, ready for the 17th of May. In the meantime, on the 30th of April to the 4th of May, they will conduct face-to-face, well, Zoom to Zoom, I suppose, interviews with 30 residents and visitors to find out what's worked for them. In tandem, we'll run a survey for all of our residents in the next issue of our City Household newsletter, and that will provide us with the insight we really need to be ready for the 21st of June. So whatever the restrictions are, we'll have both business insight and resident and visitor insight to tell us what would make the biggest difference for them to help them be safe and act safely when they're moving about the city. Thank you. That's it. Thank you. Happy to take any questions.
Thank you very much for that, Claire, and open it to any comments or questions. If not, to note all of that work, and I think, as you say, Claire, as we continue in the safely recover phase, it's going to be even more intense than some of that previous work in the city. So thank you very much for that. That then takes us on to agenda item 10, which is an update from the Universities and Higher Education Group, and over to Charlie.
Very briefly tonight, Keith, the colleges had a good run up before Easter and will return after the Easter break, I think operating pretty much as normal. 2 big uncertainties around universities. The first is that we still await further government guidance on whether the final group of students to be eligible for in-person teaching may return to in-person teaching or not. That guidance was promised by the end of the Easter holidays. We understand we might get it sometime next week, which is after the end of the Easter holidays for quite a few universities, and only just before the end for the University of York. We understand this may well say that there will be no return to in-person teaching for that tranche until the 17th of May, which is after teaching has finished for almost all students in that category. We are disturbed by this, annoyed by this. You can have a tattoo, but you can't have a socially distanced seminar at a university under very carefully managed conditions, and that point has been made very clearly to our government. The other uncertainty is around testing. We want to use mass testing to ensure that we can close down transmission of the virus where it exists. And we understand that university students will soon be eligible for home testing kits, as well as the various testing centres that we have. But we have, as yet, no detail on how this will work. So basically, we're waiting in the university sector for government to give us some more information.
Thank you very much for that, and happy to open it for any questions or comments at this stage, if there are any. Fiona.
It's just really on that testing point, Charlie, and I think it is disappointing that we haven't had guidance nationally about this, but just our commitment with our testing sites in York is that if students want to access them to have tests at the site, obviously they're already doing that, they can continue to do that, but our collect offer for students to be able to test at home, we're quite clear that they can access that as well, and we've been working and we'll continue to work with you to make sure that that message gets out to students so that they're aware of that.
Thanks, Fiona. That's great to know. And I should say again, I've said it before, The closeness of the collaboration on testing between universities and city is quite exceptional here compared to other places, so we're very grateful.
Thank you both. Julia.
Thanks, Keith. I mean, I just want to thank Charlie and his university colleagues for the strong representations they're making to government on this issue. I mean, I think students have had a really rough time of this, and you know, they have a whole load of mental health concerns around students and their well-being and all of the rest of it. And I just say thank you to Charlie and your colleagues, because we've got to get them back. I mean, just from a personal point of view, but also, you know, their well-being, but also for the economy of our of cities like York as well. You know, we need them to be back. So thank you. And any parental support, I'm sure there's loads of parents out there desperate to get their kids back to uni as well. I am.
Julia, thank you very much. I mean, that well-being point is absolutely central for us. It has been a really difficult year. We have some evidence that students who are staying at the family home are feeling less good than students who are at their university city. And our intention is to be clear to our students that on grounds of well-being, it is possible to return to your university city, notwithstanding government guidance, even if in-person teaching is not available. And any students which make that decision on well-being grounds will have our full support.
Thank you very much for that, and obviously we'll note that update and the conversation that we've just had. That then takes us on to agenda item 11, which is items for the next agenda. So again, to give a couple of seconds for any colleagues that want to raise agenda items here. If not, please get in touch outside of the meeting, and we'll make sure that they're added to future agendas. Thank you very much. Agenda item 12 is dates for future meetings. Our next meeting day is Wednesday, the 19th of May, which I'm sure you'll all know. And then agenda item 13 is any other business. I have not received any items. Julia.
Yeah, Keith, this will be my last meeting, so I just wanted to say thank you to you and to everybody, all the colleagues around this table. I think it was really great to see the results of the peer review from a partner that's been involved in all of this over the last year. I think you've done a fantastic job, so well done. Yeah, I shall watch with interest as life changes for me, but thank you very much.
Thank you, Julia. And I'd forgotten. It shows you how quick elections come around before you blink. But just to return the thanks to you, and I know your really active engagement, not just through the pandemic, but previously in York, which I and lots of partners on the call really appreciate. I'm sure you'll know that York and North Yorkshire are places you can't easily escape from. So I'm sure we'll see you in different guises as the weeks and months go on. But thank you very much. I'm not aware that there is any other business. So again, just checking that nobody's raising their hand. So to thank you all for coming and your participation in today's meeting. And then I will see most of you, but not Julia, who might have the biggest smile for the next meeting on the 19th of May. Thanks all. Bye-bye.